welcome everyone. Thank you so much for joining us for today's session, Action for Advocacy, How to Make a Difference by Telling Your Story. My name is Jackie Zimmerman, and I'm the manager of Public Education Partnerships and E-Learning at Mental Health America's National Office, and I'll be here to help moderate today's session. I have just a few notes before we get started. This webinar is being recorded and will be emailed out to all registrants within 1 week. We currently do not offer CEUs, but if you would like to request a certificate of attendance, I can give you that. I'll put that link in the chat just shortly. You can fill out the form and then a certificate will be sent within the week. I will also include that link in your follow-up email. So if you don't get it out of the chat, that's okay. It'll be sent again. Like I said before, please use the chat to ask those questions, make comments. If we do have any time at the end of today's session, we will be gathering any questions from the chat and we'll ask our presenters those as time allows. As many of you know, it is May, which means it's Mental Health Awareness Month. Happy May. At MHA, we are super excited to have our campaign this year as Turn Awareness into Action, where we are encouraging individuals to not only just take action for their own mental health, but also to start to take action for others. And so that's really what we're going to be talking about today, is how to use your own personal experiences, your story, to be able to make change and help impact not just yourself, but those in your communities and those nationally. So I want to note that we have some incredible action guides through Mental Health America for the month of May that you can download. I'm putting that link in the chat right now. So take some time to explore those, familiarize yourself with them, and utilize those great resources just in May, but throughout the next few months. But to get into discussion, today we are joined by three of our incredible young leaders. With us today, we have Kaden Sagendorf, who is a member of MHA's Young Leaders Council and junior at the University of Utah studying psychology. We also have Margaret Garcia, who is another member of our Young Leaders Council and Latina mental health advocate aspiring to obtain her JD and PhD in clinical neuropsychology. And we also have Elizabeth Chai, who is a member of our Young Leaders Council and mental health advocate and emergency medical technician based in New York City. Welcome, welcome, welcome. First, I would love, beyond just those brief intros, for our audience to get to know each of you a little better, because you are all extremely accomplished and just doing such incredible work. So I'd love if you could introduce yourself, give us a little background on you personally, professionally, just so that everyone who's joining knows who we're here with today.
I can go ahead and go first. Hi, everybody. My name is Kaden Sagendorf, and I'm calling out of Salt Lake City, Utah. A little bit about me. I'm the youngest of 7 siblings, and I was raised in southern Utah. Interesting story, I was actually put up for into foster care at birth, and I was adopted officially about like a year later. Unfortunately, due to some mental health circumstances that I'll talk about later on, I was placed back into the foster care system at 15, where I then aged out of the foster care system at 18. So that's a little bit about me. I grew up as going to performing arts school, so I play the violin. I'm also a singer-songwriter on the side. But yeah, I'm just very passionate for mental health. I'm currently a student at the University of Utah studying psychology. I also have aspirations to be a clinical neuropsychologist and a JD. I want to pursue both law and psychology at the same time. I think a lot of those intersectionalities overlap when it comes to working in child welfare and foster care policy reform. But yeah, I'm just super excited to be here and to be a part of this discussion, and I can't wait to hear everyone else's topics.
Thank you, Kaden. Like you, I also aspire to have a JD and a PhD in clinical neuropsychology. And for my emphasis, I prioritize more research-based. As Jackie mentioned, Kaden is more on the policy side, but I'm more research-oriented. And there's different perspectives that you can take in that kind of way when it comes to advocacy. But I have a particular focus on Latino mental health. And right now, I am a research assistant at the Heart Lab working for UCLA. We're a BIPOC lab focused on suicidality in terms of youth mental health and it is that right now we're focusing on a study actually involving storytelling where youth who were previously involved in the juvenile legal system experiences can tell us their story. And so we're hoping to have some policy involvement in that through their storytelling. I'd love to send an email later and a couple more informations on that if anybody's interested.
Hi, I'm Elizabeth. I'm a sophomore at Stony Brook University, double majoring in biology and philosophy. My background is primarily in fire, emergency medical services, and health and social services recovery, so working like post-disaster relief. And my work is primarily concerned with how we can better align missions in healthcare, research, and education to mitigate disparities in health outcomes and quality of life.
Amazing. Thank you all so much. I see all of the hearts and the claps and the thumbs up, and I want to emphasize that it is so great to have each of you with your unique experiences joining us for this conversation today. And I want to start just by talking about when we're getting into advocacy, a lot of it is based on because there's a reason why. There's a reason why you want to make a change, why you want to help, why you're passionate about different areas of advocacy. So I'd love to hear from each of you kind of what inspired you to become a mental health advocate and how did you first get started in that?
Yeah, I can go ahead and go first. So, staying true to my roots, I actually consider myself a foster care advocate before mental health advocate. Like I mentioned, I was in the foster care system, and so that's kind of what inspired me to become a mental health advocate in general. So, throughout my time in the foster care system, I experienced a combination of residential, congregate care, and mental health facilities. And I think that really gave me an aversion to quick fixes, to over medicating youth, and all of those issues and so forth. And so I think just those experiences really inspired me to be the person I am and to, pursue a clinical degree and, help people more holistically instead of just medicating them and doing a quick diagnosis with them. But yeah, I would say just my lived experience in the foster care system really inspired me to become the mental health advocate I am. I think a lot of the times in child welfare, we're working on so many different aspects when it comes to housing, mental health, everything. So I think it's just a really great overlap and a different perspective that I bring into this field. But that's kind of what inspired me to become a mental health advocate. And I'm just using my lived experience and my educational background as well to hopefully reform the child welfare system as a whole. So.
Thank you. And for me, it was actually because of some disparaging comments that I received when I was getting my degree at UC Merced. I graduated in 2022 with my bachelor's in psychology and a minor in political science, and I was always interested in exploring that kind of route. But there were a couple comments that I got from distinguished professors that made me really push towards it. And one of them, I was asking a professor, of the importance of like cultural competency when it comes to childhood mental health care accessibility and emphasizing the importance of like Latino oriented specified kind of assistance in comparison to that of normal or like not normal, but like the importance of specifically s- ethnic support. And he said something along the lines of like, it doesn't matter, like everybody's the same. And so that was really disheartening to hear from like a distinguished professor. And then there was another distinguished professor who I asked regarding a research topic that I was interested in exploring, which was femicides and mental health in relation to Latinas as a result of femicides in Mexico. And he said something along the lines of like, I wrote it, it doesn't matter, women die everywhere anyway. And I was like, okay, that's disheartening to hear as well. Like nobody's really, and everybody was kind of disregarding that there's a specific issue that impacts the Latino community, and there's like cultural backgrounds and ethnic significance, and there's so many things that can make us different. And when it comes to mental health care accessibility, and they just both kind of ignored me, and I think that really also pushed my emphasis to be involved more. And yeah, and like sooner or later, some other things happened as well. Like doing my research, I got inspired to have more personal take involvement. That's why I'm trying to pursue my JD as well, because there's only so much that you can do when it comes to the research background, but I want to be able to be involved physically and actively as well.
So I grew up in Queens, which is the most ethnically and linguistically diverse county in the United States. And I think to enjoy such a rich tapestry of experience is to be simultaneously aware of this like heterogeneity of struggles that kind of lay beneath. And while I might not understand these like for everyone in full, I do know my mother, having navigated the ins and outs of her health over the course of the years, and also more recently mine. So my commitment to mental health and public service kind of stems from this desire to support my community after bearing witness to these many ways that society has failed it. And I think that it's like a little ironic that these people who often go unrepresented in normative and critical discourse are the ones who face that greatest consequences of systemic inequity. And I hope to use those experiences to bring intentionality and ethical responsibility into direct services.
Thank you all so much for sharing. It's always great to hear kind of that personal connection and what's driving you behind your work, what got you interested in advocacy, and maybe what were some of those things that you each saw that you wanted to make change in the system. And I'd love to talk about, I know today we're going to focus a lot on kind of storytelling. I want to ask each of you how you've been able to channel your personal experiences through storytelling to really drive your advocacy work.
Yeah, I can go first. I think kind of like I mentioned, being in the foster care system, a lot of the times we're asked to share our experiences on certain things. And so that's kind of where my storytelling started, was speaking on different panels about my experiences in the foster care system, speaking at different conferences, etc. And through that, I've learned that sharing my experiences is important, but the way I do it is also just as important, especially when it comes to protecting your mental health. And so that's something a lot of the times, in my experience, you learn the hard way, unfortunately. So I've definitely been in spaces where I've been tokenized and manipulated, but I'm here now as the person I am today. But I would say, yeah, it's definitely a difficult thing to wrap your head around and to really navigate. But I think as long as you stay like true to yourself and authentic to, the point that you're trying to make, I think overall really fits for the work you're trying to do. Um, I think for me, trying to find those spaces where my voice actually matters on like a committee or like a council, where I actually have the power to influence change as well with other either policymakers or et cetera. And so one of those things is I sit on a board for the state of Utah to help improve our court improvement time for the child welfare system here in Utah. And so I am a board member there, and I use my lived experience and my storyteller telling stories to influence change that way. So that's a little bit about that.
For me, it was, let's see. Mm, what was the question? Have you been able to channel your personal experiences through storytelling? I like that question. I had a thing in mind. But same as Kaden, though, to the extent of being able to be on advisory boards. For this one, I'm on Mental Health America. I'm with the Born This Way Foundation, um, Active Minds Trailblazer as well. Those more, they allow me to share my story and be involved in policy work and be able to share my experiences and lived experiences are one of the most impactful things that I think can drive policymakers because when you share your personal stories, it really influences people and how they see the proposed bills or the proposed policies and like, okay, maybe this person who's sharing their story, like seeing how they lived out, maybe we should do this bill or maybe this bill wouldn't work out in the end because it affects them in a negative manner or maybe even a positive manner. Um, and so I think being able to have those kinds of positions where I'm able to speak freely and people are inviting me to speak freely and they're open to having me share my experience is one of the things that really motivated me and like really inspired me to continue having these kinds of conversations. And some other things that I've been able to do is finding the spaces that are open to it. So I'm also written a piece for the UCLA Survivors and Allies student member, where student organization where I posted a position on AI and the impacts that it has on women, particularly students in the UC system, and how that can negatively impact their mental health. And I aided in proposing um, a petition in where we address that kind of issue through an administrative position. And that was really interesting. And just being able to have those kinds of spaces where you can find them and people are wanting to hear your story is something that really can drive somebody's personal interest in wanting to be more advocacy work. But yeah.
I think for me, an important part of my advocacy is not only directly advocating for others, but also creating the space and providing the resources for people to continue to pursue what is important to them. I think oftentimes when we talk about raising awareness or public education of a given topic, we resort to statistics as this like nice, clean, concise way of conveying the magnitude of a problem. But that's not to say like statistics aren't important because they do allow us to precisely identify needs and like inequalities or perhaps evaluate the effectiveness of a certain policy or intervention. But the thing is, like, lived experience is no monolith, and most people aren't particularly data driven. It's the stories that move, and it puts a face, a voice, and a meaning behind those numbers. So sharing your personal experience provides this certain ethos where it makes mental health a shared conversation instead of an individual struggle, and that act in itself, I think, can be empowering.
Yeah, thank you, H, so much for that. I know I've seen a lot of people sharing in the chat, and I want to thank you and encourage you to continue doing that. And I want to talk a little bit about how to make an effective story. You know, we have these experiences. We each have our own perceptions, but when it comes to actually crafting a story of your experiences in a way that makes it effective, it can be challenging because a lot of times too, if you're working in advocacy, you have to be able to almost have like these elevator type of pitches that when you have limited time, you're able to talk to people quickly, or you want it to be a story that resonates with who you're talking to be able to get to that change. Um, I'd love if anyone has kind of an example of a time when storytelling directly influenced policy or public perception that you can remember, either a story that you've told and or a time that you've shared, or something that you've seen that stood out to you that was really effective, and kind of what made it so effective that it inspired that change.
I can speak. So it's something a lot of people are probably really familiar in this space. Sorry. Um, yeah, I can speak to that. Obviously, growing up in the foster care system and being placed into congregate care placements, aka the trouble teen industry, especially here in Utah, there's a bunch of them. So there's a law that just passed here in our Utah Senate, and I was able to testify on that and use my storytelling abilities to kind of testify on behalf of the passage of this bill, which was a really big bill to help protect individuals in the residential programs. So that's one example I'd give, is just really being able to figure out avenues where you can speak on hearings, conferences, etc., to be able to influence change. Yeah, that's an example I would give for you.
From my end, I personally don't have an experience that I'm related to on public policy or anything of that sort. But I know one of the strongest indicators is having that lived experience and being willing to share it and having that platform. And Active Minds actually has the opportunity for youth to be involved in sharing their personal stories in order to drive mental health change. Um, there's the link for that. I think that works. And yeah, just being able to have to really emphasize the importance of why a proposed bill would impact you in a positive or negative light, and sharing that connection to your story and trying to make people understand the importance of like, okay, this is going to impact our community, this is going to impact me in a specific kind of way, and I need you to hear why and like what like potential outcomes for it would be. Um, you have to be able to have like that kind of platform, not platform, but the willingness to be able to speak up about it is one of the strongest things that can push policymakers to kind of be influenced more. And you see that everywhere. Like that's why you see them on the news, people telling their story when they're at a meeting or like when they're on the platform, like this is my personal story. Like they broadcast those because those are so emotional and those can drive that kind of change.
Thank you both so much for sharing really great examples. And I know sometimes when we're thinking about this, it can be hard to conceptualize kind of how you make that impact, but truly when done effectively and getting to the right audience, such great change can happen. Which leads me to my next point of once individuals have decided, you know what, I want to be an advocate, you kind of figured out how to craft your story, what you're interested in, where that advocacy energy is going to be put into. How can you ensure that your story is being heard by the right audience, such as lawmakers, community leaders, media? How have you found your way to get your story out there and get into these advocacy spaces?
I can go ahead. I would say first off, definitely do a lot of research and networking. That's been my biggest success. LinkedIn, I use all the time, networking just in person, talking to people. I make it a point whenever I go to a conference to talk to as many people as I can, to leave them with something and to also take something from them as well. So networking is super big. I would also say when it comes to being an advocate, in my own opinion, addressing mental health is huge. It's a huge topic. And so for me, I come into this realm, kind of like a subcategory of that, which is child welfare. And so I would say that also has helped me kind of craft my expertise when it comes to making sure my voice is heard by policymakers, et cetera. And so like I mentioned, through speaking on panels, I was connected to some lawyers and attorneys and court people. And then, now I'm sitting on their court improvement program. So that's an example of one. I would say also to really being selective and using your speaking skills is a term I'm looking for. Professional speaking skills, I guess, when it comes to advocacy, and just making sure you're not oversharing, and also just making sure your audience is applicable to what you're talking about. And so I just spoke at a conference recently to a bunch of like attorneys on, parent time and stuff like that in the court space. And I was having a really difficult time. I was like, okay, defense attorneys for families, but how does that really shape into me as a person who was in the foster care system? So it was kind of a back and forth, but I talked to the director of it and I really figured out, okay, this is really what I want to address. And this is the target audience that I'm trying to talk to. So I would say really just do a bunch of research, follow up with people. Don't be afraid to ask questions. At the same time, using your voice in storytelling is also going to make a change regardless. So if it's in front of a council, a committee, attorneys, lawyers, judges, the president, whoever it might be, your voice does matter. So just remember that.
Thank you, Kate. I really like that one too. And I just wanted to say, add on to that actually. So most people when they start off wanting to be an advocate, they get really nervous because they don't have like the experience or like they don't have like the name brand or anything like that, but they are interested in sharing their voice or just being involved in that kind of community space. And so, like you said, LinkedIn, I think was one of my strongest networking platforms that I was able to connect with other people who are interested in that kind of space and being able to search people and just wanting to connect with them, just having like a quick coffee chat and just like, oh, like, can you tell me how you got into this field? Like, what were the indicators that helped you or like what brought you and like what were your networks and stuff like that? That is one of the strongest things that helped me. And there are some people like Juan Acosta, I really love a lot. He's a mental health advocate and he's involved in policies and he shares his platform and his experience as well. Um, but just if you're too, like, if you don't feel comfortable enough to be able to speak to on those kinds of levels, always starting in like your local community is one of the strongest things. Like, I know for me, I would like when I was in high school, I would try reaching out to like my local NAMI branch, but nobody really listened to me at the time. Probably because I was in high school, I don't know, but like, I wouldn't have a lot of people who would respond to me. But now, one of the things that I wish I could change was being able to go to local community organizations or just like activism organizations, and then that's where you could start from the ground up is being involved in like the local smaller community spaces, and that can build your confidence in order to aid in advocacy further down the line and just wanting to reach out more and be further involved. So it would start with local maybe activist organizations and then your local Congress member, your local representatives, and then you can move on from there. And starting from the bottom, I'd say, is like one of the strongest ways in order to build that network going up.
I definitely agree with both Kaden and Margaret. especially in regards to, I think, knowing your audience. For example, I teach adult and youth mental health first aid and naloxone administration to just like lay people and first responders. And even though they're like at face value the same course, if you will, the language and even the approach to kind of teaching those kind of skills for each of those groups of people is very different. And I think that is really true for advocacy and kind of working with different groups of people to achieve like a certain goal. Kind of, for example, if you're communicating with lawmakers, you might want to focus on like policy impact or like personal relevance and local data and explain how like your issue affects their constituents. Whereas if you're like interacting with the media, maybe you want to provide a more compelling narrative with like an emotional hook.
Thank you so much for all those great examples. Really helpful. I want to pivot for just a second and recognize that when we are in this space and you are talking about things that are personal to you, experiences that you've had, and you've crafted this story, that takes a lot of vulnerability. It takes a lot of emotional energy. It can be exhausting in itself. And I know it is so important, especially when we're talking about mental health, that you are protecting your own mental health while doing this work. How, as you, as an advocate, how have you been able to make sure that you're maintaining your strong mental health and kind of protecting that peace while still being able to share your story in these meaningful ways?
I think a really important part of kind of like keeping yourself safe is setting boundaries around what and when you share. Obviously, your story is important to your advocacy efforts, but there are certain parts that you might put out to the world and certain parts that you keep more private. And sometimes that changes from time to time as well. I think that like there's a difference between wounds and like healed scars, and also connecting with peers who've had like similar experiences and building a strong support system. I think part of advocacy, oh my goodness, is helping others build a support system. So making sure that you're prioritizing yourself as well.
I'd like to add on to that kind of I really agree with that. Having a strong support system is really impactful, especially because this kind of work is so stressful. And at times, especially in this current political climate that we're facing, we're seeing risks to like research, grants being cut, and organizations funding being cut. So another route aside from that, I would like to add on to is having like a spiritual connection and just being wanting to have faith. I know Victor no Naro, he is I think he's a professor for the UCLA Labor Center, and he's a law professor, I believe so. I met with him a couple weeks ago because I'm also a UCLA Central Valley Law Fellow, and so that kind of added on to my JD interest. But he mentioned how spirituality and mindfulness is something that is really important to keep track of and like maintain in this kind of field, and just wanting to take moments to yourself is especially important. And I think he also has a published piece from a couple weeks ago where he mentions that in this current political climate, there's an abundance of news sources that keep hitting you in the face, and it can be overwhelming at times to have to see everything come so at once and so fast. And so being able to have this kind of relationship with your phone or like with the news or anything, um, is really important in order to maintain your sanity, I'd say. So just like maybe a couple hours away from your phone, or if you really need to know, just make sure you only follow like this time frame, and just keep like a good portion of time daily to just connect with your loved ones, because in this time we're seeing like a lot of stress rise, and it could be extremely impactful and overwhelming at times. So just having the close family, and I'd say being, if you're spiritual, if you practice mindfulness, those are also going to be really helpful in this kind of time.
I definitely second Margaret and Elizabeth. I agree with both of those points. I think just the last thing that I would mention is just like boundary setting. I think a lot of the times when you come into these spaces, there's a lot of people that sometimes just expect us to be able to share our lived experience and to share all these skills that we have. At the same time, it's all about setting those boundaries and sharing whatever we feel is comfortable. There's this level of engagement. It's called Heart's Ladder, and it's how you quantify like levels of youth engagement when it comes to organizations, etc. I'll definitely drop it in the chat when I can pull up in a second. But kind of like I talked about previous of, using my lived experience of house care system, I was tokenized, I was manipulated. And so those are areas of youth engagement that you do not want to be when it comes to using your voice and using your lived experience. And so definitely just making sure you have those boundaries and knowing that what you're sharing, you can always decide what you want to talk about, when you want to talk about it, and how you want to talk about it. Just never being afraid to speak up for yourself. So that'll be the last thing I say on that.
Yeah, absolutely. And thank you for that really important point, Kaden. I know someone in the chat had been asking about that, where's that line between sharing your story and lived experiences without that exploitation of your story. And so making sure that you are really protecting yourself, you are always feeling comfortable and you're never feeling pressured to share anything that isn't a choice, to make sure that all of that protection is there for you and yourself. Those boundaries are extremely important. Thank you for that. And just taking care of ourselves in general throughout all of our work. I know so many of the folks who are joining this call, you might be working in a community setting, you might be working in a mental health setting, in a school setting, all of the time, making sure that we're enforcing that really strong self-care. I think those boundaries, Margaret, that you brought up with cell phones and news, especially in this time, are so important. When we're advocates and we're in different spaces and you feel like you need to be plugged in to what's going on so that you're aware and you're able to stay up to date, it's that hard balance of finding that space where you are informed and you're educated on what's going on without that constant bereavement of information that can overload our system and really just cause so much stress. So finding those different ways, whether it be shutting the phone off, connecting spiritually, connecting to community, having that strong support system, like Lisa said, all really important things. I want to pivot for a second, and I know that someone had asked in the chat, but how? How do we share our stories? How do we craft our stories? And I'd love to kind of dive into that. I know that at first it can seem intimidating to get into advocacy if it's something that you haven't done before. And so I'd love to hear kind of a two-part of what advice would you give to someone who is intimidated to start? And then what are those first steps that they can take to start to craft their story to share?
I can go. I would say starting anything new can be really scary, of course, especially when it comes to being an advocate and using your voice. Kind of like I mentioned before, definitely be selective when it comes to the type of advocacy that you're wanting to do. And I think that will also help calm the nerves a little bit when it comes to figuring out the type of advocate you want to be. Um, Also, too, I would say, um, let me think. Sorry, it's a big question. I would say, yeah, definitely be selective of, what you want to do. And then also, yeah, let me come back to this question. Sorry.
I mentioned earlier as well, starting from like local organizations is really helpful. And yeah, but like I remember when I was starting out, I was also really intimidated and I didn't really want to reach out to anybody, but I know I wanted to start somewhere, maybe like online, or like I was too scared to actually attend in-person meetings or just on me like meetings in general. And so I feel like a lot of people disregard the importance of reaching out to your Congress people, not like that, but like so Mental Health America has the opportunity for youth who are interested to be involved in the advocacy network, actually. Let me see. Yeah, these two. And these kinds of ones allow you to be involved, but not necessarily like to an extreme extent where some people might feel uncomfortable. And so you could start off with just writing, sending the little copy and paste email that they have, or like, dear Congress people, dear congressman, dear representative, and that all you have to do is just type in like your zip code and stuff like that. So like people disregard like how important that kind of thing is because you are sharing your voice and like people, like your representatives want to hear your voice, and people can disregard that one because like, oh, like I don't feel like I'm actually involved, or like I don't feel like I'm actually advocating for anything because like I'm not writing anything, or like I'm not sharing my voice verbally, I'm not in any meetings. But like those kinds of small things can lead up to greater things, and like that can build your interest into furthering continuing advocacy. So like even just being able to do the copy and paste email thing is just one step that you can be involved in. And like building up your confidence from there can help greatly. And then you starting off from there, like I also shared the advocacy network where it gives you the opportunity to be involved in those kind of things, but by sending you notifications on like certain bills that are coming your way in your state or anything like that. And just like small steps like that can make a huge impact in building your confidence. And aside from that, if you go on to, like the next step, just being involved in your local community was really important. And they don't even have to be like actively building policy or anything of the sort. They can just be in your community and just like, oh, I'm hoping to see if this organization would be interested in sharing this flyer for your students or anything of the sort. Or like even a teacher can go in and just say and just share these kinds of opportunities for their students. And just like, oh, if any students are interested in any mental health resources, like this would be a good list for you to follow. And just sharing that type of opportunity with their students could be really impactful. And that's a form of advocacy in and of itself because you're involving students in that way and you're just being and sharing these kinds of resources.
I also wanted to add that I think that the digital landscape has really evolved the advocacy space, especially in recent years. Like platforms like TikTok, Instagram, and YouTube are really reshaping mental health narratives in real time. Like we're all currently gathered on a Zoom meeting or like learning about how we can tell our mental health stories. And it's like something as simple as like writing up a post is a form of digital storytelling, and it's educating friends and followers. It's calling out systems that fail people. It's pushing for school counselors, crisis response teams, trauma-informed workplaces, and you're doing that all from the palm of your hand.
Yeah, it's such a great point. Storytelling can happen in so many ways. And to your point, Elizabeth, with the new digital landscape, there's a lot of other opportunities. And even what Margaret shared with some of the MHA Advocacy Network and Action Alerts, if you're someone where you want to do something, but you're not quite sure what it is, one of my favorite things to do is fill out the action alerts. So MHA makes it really simple. We're our policy team. They are in the know, they're on the hill, they're working on different policy that's getting passed at that federal level. And you can go onto the action alerts once you sign up for them. It'll give you a pre-written template and then an opportunity where you can customize it. You can share personal details, and that's where you can really craft your story of this is how this is important to me and my community. You put in your zip code, like Margaret said, and it automatically populates who it needs to go to. Every time there's an action alert that comes out, I love being able to fill them out because it's quick, it's simple, but it's effective. So, if you're not quite sure about, do I want to write something and have it published? Do I want to speak out on social media? Do I want to take that first leap? But I'm not quite sure what that looks like. There's these small things that can start to ease you into advocacy where you're learning how to, and even every time there's an action alert, I learn how we're crafting messaging by reading what the policy team is crafting for us to share, and you can pick up on how we communicate about these things to legislators, to people in Congress, so that we can make sure that our messaging is effective. So that's a great example. Thank you for bringing that up too. But there are so many ways that, you can take that first step. And really, just when it comes down to crafting your own story, it is, as all of our speakers have said today, about tapping into your own experiences, finding that comfortable space that you feel safe and comfortable sharing, knowing who you're speaking to with your audience and how you can tailor that message to them. And really just that honesty is so important. And that's what comes across when we're talking to people in charge. And I know we just had recently our Hill Day advocacy through Mental Health America, where our affiliates and different young leaders were in virtual offices talking to their representatives about a lot of these things. And when you're able to make that personal connection, and when you're speaking to someone, we all have mental health, it's something that affects all of us. And if you're not living with a mental health condition, 1 in 5 people are. Likely someone that you know in your life is. Being able to make that personal connection and relate it back to who you're speaking to is so important. Not to go on a little tangent here and get us derailed, but thank you all for those thoughtful responses. Um, I'd love to hear from you just as we're looking ahead at the landscape of mental health. What do you see and kind of the landscape of our country right now? We're facing a lot of new and emerging challenges in the mental health field, socially, politically. Looking ahead, what do you see as being some of the most important opportunities for mental health advocacy, where storytelling will be really important?
I would say I know recently there's been discussion to have cuts for Medicaid and the research grants that I mentioned earlier, which is impacting everybody, and especially in my field as well, in my own lab. Um, but I'd say being able to share your story and saying how it impacts you personally can really change people's opinions and like bring them into a conscious stream of like, okay, like this person actually shared their story and now personally seeing how this is affecting them. And if they're sympathetic, they can understand the situation that you're going through and how it impacts you. And instead of just like, oh, they see the text through a bell and like, okay, whatever. But like if you share how important it is to you and how it will impact you, that can bring change because they can see it through your lens of how the changes can happen and what would happen in the future if certain bills tend to pass. Um, and to going back to what Elizabeth said, I think the digital portion of it, digital advocacy is one of the strongest things that we can really build on right now. And going back to like if you were intimidated, you can just even liking and sharing a comment or a video or a post so where it can come up on other people's pages and maybe they can see their perspective as well. I think that like, it's small, but it makes a great change to the algorithm and it can build a greater impact further down the line.
Something I'll add to that is just coming more from kind of like the policy space. I know I do a lot of work in child welfare, like I mentioned, but that work is bipartisan. Obviously, with the new administration, I'm seeing a lot of fact-based evidence when it comes to research, mental health, etc. And so something I would say, and it would be an advantage and an opportunity looking forward, is whatever work you're doing when it comes to storytelling, make sure it's based in evidence, facts, and then also see if there's a way for you to actually show to people what you came up with. So if that's a report, if that's a draft, if that's a podcast link, something like that, I think is very important. A lot of the spaces that I go into now as an advocate, I make sure that there's actual like materialistic evidence of what I'm working on so I can show people the impact that I'm making. I think impact is key, especially when you can show that to lawmakers, etc. There's something I'll drop in the chat that I worked on last year. We had a youth and transition policy summit in the state of Utah, and we worked on different policies that affect youth. And so we came out with a report that I'll be sharing in this link. But it's just a really great way to keep people aware of what's going on with, those facts, the data, et cetera. That's just kind of the realm that I bring into this. But yeah, that would be my advice when it comes to opportunities and sharing your voice.
I like to add on to that actually because I thought that was really interesting. Thank you, Kaden. But like even in this current political climate that we're seeing, a lot of things can be advocacy, whether you expected it to be or not. And like for me, I have an Instagram page, Latina Psychology, where I emphasize Latino-oriented psychological research. And like I didn't originally for like a year ago when I first started it, I didn't realize it could be in the term like a political advocacy page, but now seeing that certain research funding grants have been cut because of the term mentioning Latino, Latina, female, Black, BIPOC, like those kinds of terminologies I didn't expect to be seeing. And now that grants have been cut because of mentions of those terms, it is political now. Like it is advocacy, whether I originally thought it would be or not. And just being able to have that kind of sharing, like through social media, like being able to create a social media page and just talking about it is now advocacy. Like we're seeing people detained at airports for their social media and just go like, oh, do you support this policy and stuff like that? But just you you never really realize what can be t advocacy until certain things push you to that kind of extent. And just being able to share your voice, and especially now, I think is one of the strongest things that you could do.
Absolutely. Just using your voice is so important in whatever way you feel most comfortable, and social media definitely opens up a whole new space where advocacy is happening, which is really cool. Um, a question from the chat, someone had asked, are there steps that you use when you're crafting your story? Any kind of template of sort? I know, Kaden, you started to talk about, the importance of that evidence, bringing in that materialistic evidence, facts. Do you have kind of like that template of, do you open with something personal and then go into that? Do you start with the facts and statistics and then go into a personal story? Kind of what does that look like for each of you?
I would say for me, it's definitely a case by case basis. Obviously, like I mentioned before, when it comes to sharing your story, make sure that your audience is matching, what you're talking about. But yeah, a lot of the times, I do start with like a personal lived experience story that, kind of they can relate to, something that they can like, okay, that makes sense, of, the concerns that you're having with whatever policy. But yeah, I would say really case by case basis. But yeah, I don't really have like strict steps or anything like that. I'm usually just sharing my experience and then, showing them data and why this matters. And then giving them something, advice to, how we can change this or how we can improve the policy or et cetera.
I
Yeah,
just
that's
kind of wanted to add on to that. I think in like very frequently in like mental health spaces, we use the term lived experience as kind of a catch-all for individual perspectives, but obviously like lived experience is not going to be the same for like different people. So kind of bringing in like a personal experience to contextualize where you're coming from, and then also following that up with data to support broader trends occurring.
Can I add to that? I think in this kind of context, people also forget the importance of just like what was it? It was persuasive writing. Like even taking a persuasive or creative writing class is actually really strong in order to create your story. People forget the importance of like ethos, pathos, logos, and where you're talking about your credibility, your personal experience, and then you're sharing a story in order to build sympathy with the audience. And then what was the other one? It was like the statistics and the facts behind it. That is that those kinds of bases for writing and being persuasive at writing is one of like the strongest foundations that you could do in establishing your kind of story and like selling your character in order for people to hear you. So like for credibility, you can say like, oh, um, like like for me, it would be like, oh, I'm a researcher at UCLA studying psychology, and pathos would be like we're like funding for grants are being cut, and we're focusing on the Latino population, and then a few other things. But like that kind being able to write like with the basics of foundational writing is also like something that people forget a lot, and you have to kind of go back to that and just go like, what could make a persuasive essay or like that kind of base, like even the basics is people forget.
Absolutely. All really helpful points. I know someone had asked in the chat when looking for data to use recommendations on where to find it. I know sometimes you'll find that when you're looking at different studies, they might be behind some type of paywall or they're harder to access. But one of the easiest things you can do is switch your regular Google from Google to Google Scholar. And then once you switch to Scholar, it'll automatically start filtering out for those evidence-based resources. Um, Panelists, feel free to drop any other links or places that you tend to find your research in the chat. Um, I want to kind of wrap up today with just hearing from each of you kind of a final reflection on if we have people who are in the room today that haven't taken that first step in their advocacy journey yet, but this inspired them to, what is one kind of final message that you could leave them with to give them that nudge to get into advocacy? I know it's a big one.
I'd say right now it's mostly take action before, it impacts you because when you speak for other people and you support their causes and just, being able to be vocal and having empathy and sharing that kind of experience and understanding other people's experiences that they're going through in this kind of climate is really important. And just go like, okay, I understand what's happening with you and I should help you. And like, I know some people may say it's a little like narcissistic, you're just a person, but like it's in order to just relate it back to yourself. But you have to help, you have to be willing to help other people because that can build your confidence in order to build support in helping yourself in the end. Like we know that there's going to be certain things that impact everybody personally, individually, and it may not be happening to you right now, but just know that there are other people who are also being affected, and you should be wanting to help other people, regardless if it relates to you personally or not, because if you don't, eventually it's going to come to you, and then there's going to be nobody to speak on your behalf. And wouldn't you want somebody to help you in that case scenario? And just being empathetic and sympathetic to people's needs and wanting to speak on their behalf and supporting them is something that I believe is like one of a really strong indicator because you never know what could happen. And being vocal is one of the strongest things you can do in this climate, especially social media is one of the strongest things that you could use right now, even if there's certain things that are making it impossible for you to physically be involved. But speaking and starting off one by one, especially with like those little the Mental Health America Network ones where you're just signing the the copy and pasted message, that itself is an act of activism, whether people deem it to be or not. I know it's something small, but just being able to do that is something that's can be really impactful for other people who you're signing that bill or signing that petition for.
Thanks, Margaret. It's a great reflection. I think it's so important. And a lot of times, we can, yes, in the chat, it's super powerful. Sometimes we can hold back until things are affecting us, and eventually it will. Having that empathy, even if it's a topic that's not directly impacting you yet, being able to speak on injustice and be an advocate for others. Any final thoughts here? Well, thank you. I just want to give a huge thank you to Margaret, Elizabeth, Kaden for joining us today. What a fantastic hour together. I feel like I learned so much from you and was inspired by each of you. I hope everyone who joined did as well. I would just want to thank everyone again. And I know there were lots of questions in the chat about, is this being recorded? Are the links that we included going to be sent out? Just a reminder, yes, they will. They'll be sent out within a week. So we will email you all with the link to the recording, link to request your certificate of attendance. And we will also include all the wonderful links that our speakers shared today so that you can go back and check out the resources. Make sure you're subscribed to MHA's Advocacy Network. And I'm dropping the link one more time for our Mental Health Month resources. Make sure you check those out too. But thank you all for being here, for your wonderful questions, for your engagement in the chat, for sharing your own stories, and for just being here is taking that first step to saying, yeah, I want to be an advocate. I'm interested. I want to join in on this work. And so kudos to you all. It really is collective effort that we have to make in order to see that change. So we're really grateful for every person who joins us in mental health advocacy, especially to each of you today. Margaret, Elizabeth, Kaden, thank you for being here.
Thank you for having me. I'd love to connect with anybody as well. If anybody has any further questions, here's the lab that I work at.
Great.
It's the Heart
Yeah.
Lab at UCLA. I'd love to connect with anybody who'd be interested in sharing their story as well if they have any previous legal experience in the juvenile legal system. Yeah, and LinkedIn. I think everybody else would be sharing theirs, but here's mine as well.
Definitely stay connected. Oh, Margaret, I'm gonna post it because it looks like it just went to our host and panelists. I'm gonna send it to everyone. There we go. Perfect. Yes, stay connected with our speakers, and stay connected with MHA. We'll have a few more different learning opportunities coming throughout May, lots in June and lots in July. So contact information, LinkedIn, all of that we'll include in our follow-up. We'll be sure that you're able to get in touch with our speakers if you want to, and stay in touch with all of our policy work. So thank you all for being here. I hope everyone has a fantastic rest of their day and enjoys celebrating Mental Health Month throughout May.
Thank you.
Thank you all.
Thank you.